children, sleep interruption results in irritability and lack of attention. Dr. Rao and I, we become very sleepy when we don't sleep. Kids become very irritable. And if you have a kid, you know it. You are in a party, it's late, and your kids start being irritable because they're sleepy. So irritability and lack of attention are both effect of intermittent hypoxia and also interruption of the sleep. Now, in the pandemic, because our kids are not moving around, because the kids are not in the school, because kids do not have adequate amount of physical activity, and they spend mostly time on their devices or on TV, they're going to gain weight. And if they start with mild sleep apnea, they will end up with moderate or worse, which then added to the irregularity sleep causes many problems. And the kids could become defiant, as Dr. Nami mentioned that. They may become irritable, and definitely their learning capabilities will go down. So from my standpoint, what pandemics has done to us and to our families and to our kids, other than the psychological stress, is promoting presence of a sleep interruption, sleep disruption, maybe more sleep-related hypoxemia, and in long term, damage to brain and its function. Dr. Nami exemplified the issue of a car putting in your parking in compared to a car that you drive forever. The human body needs rest and repair, and the human brain needs cleaning up, reorganizing, and memory formation. And all of those happens during a normal sleep. So the quantity and quality of sleep is very important, specifically for a brain that is in the form of development. With that, I will stop here and I will give it back to Dr. Rao for the rest of the program.
Thank you, Dr. Amir. As you know, as Dr. Mohammad and also Diana and also Amir explained, sleep is a very important component of life. But the current situation, where we have the pandemic, sleep has become a big challenge actually, because people have sleep disturbances and dietary disturbances, all these things are affecting the immunity. Just sleeping is not just, lying on a bed. You need to have a good sleep, and then we call it sound sleep without breaks, intermittent breaks. So because that also affects immunity. You know that immunity has two components. One is innate immunity, which is always inbuilt for biological system. And you also have an adaptive immunity, which is a defense mechanism to fight like viruses, bacteria, so on and so forth. For example, if you have enough insufficient sleep, we always face what is called immune disturbances. And the COVID is right now an immune-based infection. So you have an intermix. So essentially, sleep is very important to keep your defense mechanism very, very strong so that you overcome the situation. And Dr. Amir has added rightly that how hypoxic condition affecting the brain, and also hypoxia is one of the clinical parameters, is only one clinical parameter. The COVID will affect you. Your oxygenation level come down. When your oxygenation level come down, it affects your brain, so on and so forth. So the very important aspect is one should maintain good diet and good sleep to keep up the immunity parameters clearly and strongly, so that you have a mechanism to fight against the COVID infections. That's why people say, oh, you have to increase your immunity, eat immune boosters, all kinds of things we are hypothecating, and we require, because it's required in that process. So in this connection, I would like to ask a question of sleep experts like Amir and Mohammad. how the sleep disturbances affects men and women in a gender base, because does it have a specific sleep timings and sleep disturbances, how it affects the quality of life?
So Dr.
Dr.
Amir will
Mohammed?
get it. Dr. Amir will get it. It's your question, Dr. Amir.
Sure.
Amir.
I
The
think
seniors,
let's
then
go.
juniors, right?
Yes. No, actually not. But I
You're
will. I
saying
will go for
yes.
this one.
That's
Yes.
fantastic. No, that's true
I'll
story.
go for. Sure. So I think it's actually more than gender-based. It is cultural-based, gender-based, and when you move to the Western world, as the roles of genders have changed, as the women have become more active in the workplace, and they have more sleep disturbances, it will affect their immunity and their function more. Uh, but I think the most important thing, at least what we see in our healthcare providers that are working with us now in the ICUs, as you know, one of the functions that I have is seeing COVID patient in ICU, and an overwhelming majority of our nurses are ICU nurses, and the doctors are divided between half women and half men. At least on their resilience and the accuracy of the performing their jobs and work, they are doing similarly. How it affects their sleep at home, and there is an ongoing study that we do not know the result. There is a very large survey ongoing internationally looking at the healthcare providers, for example, men and women differently in regard to the stress and sleep deprivation. For example, in last two or 3 weeks, Houston has become a hotspot for corona, and therefore we are being overworked, and therefore we have long shifts. Performances are similarly affected. If their immunity in acute situations are affected similarly or not is not known. One of the issues that we deal with in the effect of sleep deprivation in men and women is the issue of behavioral changes around the time of menstruation. You know, many of the women around the time of menstruation, they will have swings in the mood that is related to hormonal problem. It looks, at least some studies indicate, that they may become more irritable at the time of the menstruation if they are sleep deprived. Again, those are in the time of a stable mood. In the pandemic, we have not seen yet clear data that shows the performance of the men and women will differ. I think one question may be hanging there is the immune response will be affected similarly or not. The immune response is affected in the same direction. And let me again speak about the immune response as Professor Rao alluded to. You have a native or innate immune response, and then you have adaptive and very specific immune response. For example, when an insult happens in the body, for example, COVID-19 enters the body and proliferates, you're going to have initially an innate response that depends on the dose of the stimulants, which means the dose of the virus, the speed that the virus in your system proliferates, and your genetic background in mounting a response. That's the reason you see individuals that come with what is called cytokine storm. That means the people who come and their system is flooded with lots of inflammatory cytokines. We don't think there would be significant difference in the huge innate response between men and women in overwhelming situations like that. In milder situations between men and women, we have not seen significant difference when we adjust for comorbid conditions. Just remember, the comorbidities are more prevalent in men compared to women. Because, for example, 20, 30 years ago, men smoked more, therefore they have more lung disease. They had more visceral type of obesity, so they have more diabetes. In regard to the adaptive response that will be affected by lack of sleep or sleep deprivation, there may be some differences, and you may see more robust effect in women, but those are not completely proven in experimental model. Dr. Nami, is back to you.
Oh, sure, sure. Yeah, as you were indicating, it's important to just highlight the significance of the hormonal changes, because we know that progesterone per se has got the hypnotic effect. So during the menstrual cycle, when
Can
we
you
have the
keep
drop,
microphone, Mohammed?
okay, is it good? Uh,
Yeah,
is that good now? So when
yeah.
yeah, so by default, we know that the hormonal imbalances are one of the main culprits for sleep disturbances among, you know, females, and especially during the pregnancy period, some specific sort of sleep issues will show up, and it is partly because of the lacking effect of progesterone, because by default we know that progesterone is is a hormone which is inducing a hypnotic effect. And during the you know transition from childhood to adulthood, and when we're talking about the youngster uh, girls, so when they have this transformation in the whole dynamics of the neurochemistry in the brain from one side, and also all different immunometabolic and also endocrinological changes, then they all definitely start to have some swings in their mood, as said as I was listening to Dr. Amir, he was highlighting, and also they would have issues with when the menstrual cycle is there in the first part of the menstrual period. In that phase, because of the low levels of progesterone, they start to feel that they have issues like comorbid insomnia, so they are not able to go deep down sleep. The structure of sleep is not as that is expected to be. So the macro and micro structural and sleep cycle integrities are not there. And by that, the function of sleep will be negatively impacted, and people will come up with complaints like that. So we got to be cautious about the range of behavioral and organic sleep problems, specifically in young girls, that they are in their puberty and they are just making this transition in their hormonal balance. So a counterbalance of all different neurotransmitters in the brain is also another problem that we are facing in the age of puberty, because we have the hypoactivity of the GABA system in the prefrontal cortex, and at the same time we have the upscaled serotonin balance in the brain. So by this, we see that the dynamics, the neurodynamics, and also the uh, autonomic regulation that we expect to have for regulation of sleep is not as it should be. And specifically youngsters, or like adolescents and female adolescents, they are complaining of this sort of overt anxiety, and they are invert oriented. They have over concerns about different things, and they have also this problem with thought rumination, with depression, and by that they might be facing some kind of affective and cognitive behavior, and they have a whole storm of this transition in their lifestyle, as was alluded to by Dr. Amir. They are not, following the rules as they were used to before COVID. These days, they are everyone are following a whole different pattern in some ways, and children, young kids. Specifically, those who have got underlying developmental issues, and if we were talking about the cases with autism spectrum disorder, or we're talking about a range of all different, like genetic predicaments, cognitive aspects, that they are negatively impacted when we have issues with attention, memory,
Mohammed,
learning.
microphone.
Yeah, attention, memory, learning. I'm sorry, executive function, and all different, psychomotor vigilance and learning capacity that has been negatively impacted in children with NDD. And as we were just touching a little bit during our discussions, neuroinflammatory processes and neuroinflammation plays a critical role here, specifically when we're talking about the survivors of COVID. And we have reported that children are also, you know, they are at risk for contracting the virus. So when they are contracting the virus by time and when they are going to recover, one of the carry-on effects of the problem might be issues with their immune regulation, with the neuroimmunology harmony, and by that they might be having affective or cognitive or even physical issues with regard to their growth, with their development, learning capacity, behavioral organization. Many children that they are coming to our doors and they are suffering from disorganized behaviors, and they have lack of attention, they are hyperactive, they have a positional defiance syndrome, and they have some kind of disorganized behaviors or coping mechanisms with their issues. They might be having some neurological, psychiatric, some metabolic, and as I said, neurological, metabolic, and genetic issues. We are, tapping into all those different aspects, but not deeply we're concerned about the possibility of issues with sleep. So when it's needed, as we were talking about before, we got to be thinking about the possibility of doing the PSG and also to do the behavioral analysis of the kid, because we have a specific sort of insomnia, and maybe Diana can help us with more details on it, because we have the behavioral insomnia of childhood, or BIC, or we have sleep hygiene insomnia. We have some specific symptoms that children with
Microphone, actually.
GABA hypoactivity in the brain. So the children with Fragile X syndrome, or children with autism spectrum disorder, they might be having this GABA hypoactivity in the frontal part of the brain, and by that they have dysregulation of the vagal tone. So they have low vagal tone and they have low GABA activity and upscale serotonin distribution in the frontal and parietal part of the brain. And by that, they do not have this harmony in neurodynamics. So they need some anti, anti-adrenergic, anxiolytic medications, or the medications that they are blocking the adrenergic system, or they might be needing GABAergic medications. Some medications like melatonin has been in our references that's going to add to the level of neuroregeneration and regulation of sleep phase disorder, if that's the case. And in some other instances, we might be prescribing for children with cerebral palsy. They might have pain in their sleep. They might have uh, uh, muscle aches, and they are not able to explore it, but they have the fragmentation of sleep and they are not able to express that, right? And they have this rigidity in their joints. They might be having this problem with with changing the position. And but because of that, we might be using some wedges, some specific pillows for them, with the people who are having cerebral palsy, different kinds, specifically those who are quadriplegic, or those who are having a spastic cerebral palsy. And to close with, I just wanted to add on to what I was indicating earlier, that problems with sleep in children are partly behavioral or affective, and in part they are organic, neurological. They might be having some issues like epilepsy. So epilepsy in sleep is a key issue in kids and adolescents, that they are having issues with the sleep problem. Some people that they are, not necessarily correctly been diagnosed with epilepsy. They have been treated like, okay, they are screaming at the middle of the night, they have got this moaning, and they have catathrenia, and so on and so forth. And because of that, they have parasomnia. But many parasomnias turn out to be epilepsies. Many cases who are falsely diagnosed with epilepsy might have parasomnias, might have behavioral sleep problem. They're talking, they're walking in their sleep, they have bedwetting or enuresis. They might be, even in children, we got like reports, and we a couple of years ago, we have published a report on RLS in kids. So it is still an issue, and we need to tap into all different range of sleep predicaments. That we all know that we got around 90 types of different sleep problems. And what is probably the case in children? We got to be very cautious. We got to be very specific and very picky to do the necessary tests if indicated and required, and at the same time be very, very cautious and timely in taking a good history, in doing the physical examination as exactly as possible, examining the airway, the back of the throat, the tongue. Also, if there is a need for genetic testing, we're going to pursue for that. And if there is a need for medication as per the diagnosis, based on the PSG, we go for medication. Non-pharmacological, as we said before, CBTI and so on and so forth. And last but not least, we might be using the neurotechnology, using TES or transcranial electrical stimulation. TMS, if it is indicated, and we do not have issues with that, would be indicated. And by that, you have my voice, everyone?
Yeah, now it's
Okay, and TMS, TES, audiovisual entrainment, neurofeedback, biofeedback, and many all different new strategies and new modalities in modern neuroscience could be adding to the level of cognitive agility in children, specifically those who are already been suffering from sleep predicaments. So the better they sleep, the better they learn, the better they behave, and the better they interact with their surrounding. So they are going to make their future only if, may I say, like, not only if, but at some levels, if they have proper and sound sleep structure and they have sleep regularity, as highlighted by Amir. I would just pass it to you, Rao, or Amir, and also Diana, because I know that Diana knows a lot about the psychobehavioral aspects of sleep problems in children. So yeah, floor is yours, and help us understand better about the different things that have already been untouched.
Diana.
I I wanted to compliment something that you were saying, Mohammed, because all these problems we will see them in children, but they will translate to inadequate behaviors in the classroom, for example. And teachers are having such a hard time trying to control these students, for example, and trying to understand their condition. And you will see a negative effect on their academic skills, on their communication skills, and most of the times it is related to the sleep situation, even more so than to their actual condition, if they have a condition, if we're talking about neurodevelopmental disorders. So it is fundamental to approach these situations and help teachers understand as well. Give teachers the possibility to understand that this is an actual negative effect of not sleeping, and give them tools to help them manage these situations, because teachers are very frustrated, but they also don't have certain specific knowledge and they don't have the tools to manage these situations. So it is fundamental. In places like in Panama and in other places in Latin America, we don't have, for example, certain therapies. We're starting to have certain centers that are doing TMS, but we don't have these centers for children as a basic therapy that is recommended for them. So what we have to do is utilize the resources we have, and many times that is only cognitive therapies, for example. Besides the behavioral therapies, we do neuropsychological therapies and cognitive therapies, and we also try to educate parents and caregivers and schools. So neuropsychologists, we have...
This is critical.
Yes.
Yeah, you are just touching on a very important point, because when we're dealing with the children with neurodevelopmental disorders, specifically those with ASD, when there is a need, we got to be treating or teaching the parents, because they're playing a critical role with the family function, right? When we need to train, when we need to treat the children, we train and teach the children. When we need to train the teachers we train the teachers, all right? So it is like a multidimensional environment that children will get a chance of learning how to behave, how to learn, how to do stuff, and how to interact with their surrounding. And it's a two-way street between, I mean, the vigilance and sleep. When we do not have a good sleep, we would not have a good vigilance, expectedly in children with sleep issues. And when we do not have a good vigilance, then we do not have a good sleep. So they might be quite well separated. These two entities should be well staying aside from each other.
Exactly.
Sleep and vigilance. Well, you're saying.
No, this is fantastic that you mentioned it, the education of parents and teachers. So our role actually as neuropsychologists is sometimes to go to the school and talk to teachers and talk to therapists, other therapists, and explain certain conditions and tell them or talk to them about different techniques that exist in order to improve these conduct dysregulations and explore also possible causes for conduct problems, behavioral problems. And like I said, it is fundamental to work as a team, like you were saying, a multidimensional approach and an integrated treatment, like I was mentioning before, because we need to approach these situations from multiple places, and all in benefit of the child. Now with COVID-19, this is a little bit difficult because as Dr. Amir was mentioning, children are in their houses all day long, and it's even affecting their physical exercise. So we do need to propose different cognitive training, for example, and in Panama, there are certain neuropsychologists that are proposing gymnastics, neurogymnastics for children. And, you know, working as a whole with caregivers and children to learn different movements and to dance and to learn different techniques to relax and to cope with stress. And they are working because, well, people are in great need for these different interactions.
So we open the questions for the public. Anybody can ask questions. Please put in the chat,
Yes.
both in Spanish and English, either one of them.
If anyone has a question, si alguien tiene una pregunta, puede con gusto hacerla.
And before we get the questions, in the meantime, when people are framing, Diana will summarize the whole thing in Spanish for the Spanish group of people attending with this.
Perfect. Perfect, Dr. Rao. So let me.
Yes, so empezamos la sesión de hoy hablando un poco sobre las diferentes trastornos del desarrollo, los diferentes problemas asociados al neurodesarrollo, y yo hablé un poco sobre los problemas asociados a las alteraciones del sueño y cómo están estrechamente relacionados a los problemas de neurodesarrollo. No se separan, sino que más bien tienen una amplia relación. Y también hablé de los problemas de sueño que están asociándose a la pandemia por COVID-19. Como sabemos, esta situación de la cuarentena y del encierro y del distanciamiento social está provocando unas situaciones muy difíciles en la salud mental de la gente y de los niños. Y los niños no tienen muchas veces las herramientas para poder hablar sobre lo que están pensando, sintiendo, lo que escuchan, lo que los amiguitos les dicen. Entonces es fundamental que el adulto pueda interceder y servir como una guía para brindar información adecuada y además escuchar al niño, apoyarlo, tratando siempre de mantener las rutinas, la estructura. Las rutinas son fundamentales para el desarrollo cerebral, es necesario para el funcionamiento cognitivo, para mejorar los distintos patrones conductuales del sueño, etc. Luego los doctores hablaron un poco sobre el doctor Mohammad habló sobre cómo el tratamiento no es lineal, el tratamiento debe ser integral, debemos tener unos enfoques multidimensionales para abordar los trastornos del desarrollo y también para abordar las dificultades del sueño. Se asocian, hay muchas dificultades del sueño que se están asociando a la pandemia, como por ejemplo asociados a otros daños, como por ejemplo a la hipoxia, que fundamentalmente luego puede provocar daño en distintos órganos y daño al cerebro. Los niños están teniendo dificultades para conciliar el sueño y esto está provocando irritabilidad, disminución en la atención, disminución en las capacidades cognitivas, en la capacidad de planificación, en la memoria, y esto por supuesto afecta su rendimiento escolar si es que están en edad escolar. Entonces, el doctor Amir también comentó un poco más sobre la hipoxia y cómo esta es muy dañina para los órganos y para el cerebro, y en el caso de los niños en la pandemia están teniendo una disminución en su nivel de actividad física, por ende están aumentando de peso y esto puede provocar las apneas del sueño, que a su vez puede provocar las dificultades en el aprendizaje o exacerbar las dificultades en el aprendizaje, y afectando también el sistema inmunológico. El doctor Rao habló sobre la importancia del sueño en el sistema inmunológico, cómo necesitamos buenos hábitos alimenticios y necesitamos tener adecuados patrones del sueño para apoyar nuestro sistema inmunológico, que por supuesto se ve muy deteriorado en esta época, y más si es que la persona llega a contagiarse del virus. Luego el doctor Rao abordó la pregunta de si habían diferencias entre los hombres y las mujeres en los patrones del sueño y en las interrupciones y desregularizaciones del sueño, y lo que el doctor Amir comentó fue que no se ven diferencias entre hombres y mujeres cuando se ajusta por comorbilidades. Las diferencias también parecen ser siguiendo una línea más cultural, es decir, que las mujeres se espera que pues, ¿no?, cuiden a los niños y trabajen a la vez, entonces esto está alterando sus patrones del sueño, y por ende esto también tiene un efecto directo en los cambios de humor, en la conducta. Sin embargo, sí mencionaron los cambios hormonales y cambios endocrinológicos que existen y que estos cambios pueden contribuir a las distintas patologías del sueño en las mujeres. Y luego estábamos comentando hacia el final sobre la importancia de hablar directamente con los padres, con los profesores, para poder tener un mejor manejo de la conducta del niño y de sus patrones del sueño y de los distintos patrones que surgen en su desarrollo, que tienen que ver con su alimentación, con sus hábitos, con su aprendizaje y con las funciones cognitivas. Yo comenté un poco de que en Latinoamérica, especialmente en Panamá, en este momento no contamos con herramientas sofisticadas para las terapias. Por ejemplo, no tenemos centros que hagan estimulación magnética transcraneal como un abordaje específico para dificultades del sueño. Sí hay centros que están surgiendo y se están abordando en adultos, principalmente depresión, y en otros niños se están abordando, por ejemplo, se está tratando de abordar el autismo con estas herramientas. Sin embargo, no lo tenemos como un tratamiento prescrito para los patrones, para las dificultades del sueño, este tipo de estimulación. Entonces estamos haciendo mucha estimulación cognitiva, terapias neuropsicológicas, y trabajamos de la mano con los otros terapeutas clínicos y también con los doctores, los profesores, los padres, los cuidadores. Entonces, si tienen alguna pregunta, por favor, pueden ponerla por el chat o hacerla directamente, tanto en inglés como en español. Gracias.
Wow, that
So,
has
any
been
questions?
fantastic. How did you do that? So you just summarize all the things in like 10 minutes, yeah?
Sorry.
I mean, you just summarize everything in like 10 minutes. How could you do that? That was fantastic. Thanks for doing it.
I try to maintain to the main topics
That's good. Cool.
that were discussed.
Rao, you gotta unmute your mic, Dr. Rao. Oh yeah.
I don't see any questions yet, but if,
No.
I just want to ask you a question, to Muhammad, Diana, and Amir. We now the pandemic is creating a kind of terror in the people. People go through dreams, kinds of complex dreams about the future, about their families, about many things. How this is going to affect the sleep in children as well as in adults, because we are going through multiple complex issues now. Maybe start with Mohammed.
Oh, yeah, sure. So, as we all know, dreaming is a process that predominantly happens during REM sleep. And REM sleep is a very, very important stage of sleep, which is known to have a function in emotional memory consolidation. Okay, so the more we have problems with regulating the mood during the wakefulness, the more we would have the proportion of REM sleep. So some people have got uh, issues with substance abuse or something, they just cease from the usage of that abuse of that substance and start to have REM rebound. So by this, normally we expect to have like 25% of the whole sleep macro structure devoted to REM sleep. But when it becomes like 40%, 60%, then the moment the person starts to have a sleep to fall down asleep, they start to dream, and sometimes the dreams are very vivid because the brain becomes cognitively active, and the processing speed of the information in the amygdala hippocampal complex and also the frontal part of the brain, I mean the frontotemporal network of the brain, they will be hyperactive. So it is just going hand in hand with emotion regulation during wakefulness. So the more dysregulated aspects of emotional performance we are suffering from during the day, the more risk we'll be confronted with when of having nightmares or dreams or night terrors, as you pointed out. So it's important to stick to the positive psychology, to stay away from bad news, to stay from the unreliable something which has been not well trusted news coming from all over the place. So we got to be very vigilant about how we are behaving and how we are coping with the situation around us, and also the emotion, cognitive regulation, and positive motivational structures. These are critical to maintain a good behavioral health. Because when we're talking about health, it's not just like physical health. We have behavioral health, we have cognitive health, we have affective health, and we have bodily health. All right. So this is like a holistic approach to our health. And recently, with a group of decent people that they are based in Geneva, and they are in close link with the UN Sustained Developmental Goals, they start to define a multifaceted approach to a global health. So the global health is like a holistic approach to the brain health. So it is like inclusive brain health, if you want to put it like that. So given the whole ups and downs and uncertain times during the current period, what is more advisable to the people is that, number one, they need to have a regular daily routines. They need to stay positive. They need to stay active because movement is everything. All right. So color, music, movement, and everything which attracts our positive hotspots in our brain needs to be well touched. And if they are in the area that they have access to yoga or meditation or mindfulness practices, let's do it. And stay away from misusing hypnotic medications or misusing, stimulant, because they are going to disrupt the sleep quality. And my humble advice to the parents who are watching this is that if they have children, either typically developing children or children with NDD, and the child is having a loud snoring, or he or she is having an observed apneic pauses of breathing, right? And they have snorting or gasping or choking during sleep. And they have restless sleep. They have diaphoresis or paradoxical chest wall movement. They have this, labored breathing. And they have abnormal sleeping position. If they have secondary enuresis, these are really something. So we need to be pretty much aware of the fact that these are the things that they are going to significantly impact the process of neurodevelopment and behavioral aptitudes. And the symptoms during the day, they should also be pretty much aware of the fact that when they're children, when they're kids, they have daytime somnolence. I mean, the older kids, because the young kids, they do not show, dozing off like that. They do not show that they are sleepy. When they are sleepy, they will become hyperactive. So they are just driving you off the wall, all right? So when they have behavioral functional issues, when they have difficulty awakening in the morning, these are pretty much of importance. Morning headaches, when their children has got continuous complaint from the nasal congestion or mouth breathing, when they have elongated face, when they have gummy smiles, when they have something like, okay, something is not right. But please, let's be very cautious. Let's be vigilant about all different presentations that children with neurodevelopmental delay and sleep issues may come up with. And putting them all together, it is at the end of the day a multidisciplinary approach to diagnosis, treatment, and maintenance of brain health, sleep health, and cognitive health. Thank you for the opportunity, Rao.
Dr. Amir?
Yes, so I just want to propose a hypothesis, and I want you guys, everybody, think about it. When COVID hit us, we saw lots of elderly individuals or individuals with significant chronic comorbid conditions disappear. We saw also some younger groups that then had overwhelming exposure, they disappeared, or if they had reacted overwhelmingly through their immune system. And I want to provide an analogy to that in regard to the stresses resulting from this pandemic. So you are going to see the overwhelming majority of human beings will survive mentally with some issues related to the stress that is gradually becoming chronic, and hopefully after we control this pandemic, they will recover as they go back to their normal life. But what you are going to see are going to be the individuals who already have mental problems, and they're on the verge of decompensating because of the stresses of this pandemic. And then you're going to see individuals who are exposed to a larger load of stress, for example, healthcare workers, or individuals who have lost their income. And to that end, you're going to come to look at the kids. And kids actually should be considered as vulnerable population, because not only they have their own stresses, they perceive and embody the stresses that they see in their parents, which that will affect their sleep, that will affect their function. So what I would worry is that certain segments of population will really cave in under this stress, and their recovery may not be as expected. So what can be done? What could we do as parents? What could we do as practitioners? And if we are in touch with policyholders, what we could do with them. And I think implementing good sleep hygiene during the daytime will help, because this is another hypothesis that I have, which I discussed in a prior meeting that we had. The sleep is the place that you switch off mostly your sympathetic nervous system and you allow your vagal system to predominate. Sympathetic nervous system is equal to stress, and vagal nervous system is equal to de-stress. So you de-stress in a sleep, and if you are not getting good amount of sleep and good quality of sleep, you're not going to be de-stressing, and every day you're going to add to the stress. So I know, for example, my brother has 2 kids, school kids, and what he has implemented, because now they're always at home, so he has made the routine to take them out to exercise in the open environment on the bike or something. When you make something like that routine, that will be a time that the kid can de-stress, both physically and mentally. It's not complex, it's not expensive. It just needs the parent's attention and allocation of time. So with simple interventions that the parents can do, they can protect their child against the onslaught of this stress that we are encountering due to COVID. And that will bring sleep hygiene to the life of the parents and to the kids. It will subsequently improve their sleep, both quantitatively and qualitatively, and hopefully that will allow them to sustain and be functional, and hopefully also recover when our life will go back to the new normal. Back to you.
Diana?
So besides what Dr. Amir and Dr. Mohammed were saying, I want to look into a little bit of with this technology issue that we have. Because right now, kids have to use technology for their classes, for example. We recommend that children, especially children that have certain disorders, limit the amount of television, iPad, telephone use. Nevertheless, right now, this is practically impossible. So some parents actually the other day were asking me, because they have a child who has been diagnosed with Asperger, and they were asking me, well, what do I do now? What do I do with my child that needs to be connected to the computer or to the iPad maybe 5 or 6 hours a day? And on the weekends, they still need to do homework, so they will be connected. And then when I'm not looking, they are connected, but they're looking at movies or they're watching their shows. And my children say they give me the excuse that it's because of school that they need to use it. So this has become a very big problem. Besides routine and what we were talking about before, different approaches that can help you relax, like yoga and watching for the use of certain, maybe in children, not substances, but for example, sugar, foods with too much sugar. I think that it's fundamental to take a look at what's happening with technology and what we can do as maybe researchers or physicians or therapists or even parents with this situation. And well, I was reading a couple of papers, and what some experts propose is that even this is structured into their days. So they will be allowed to use technological equipment for their classes. Nevertheless, they need to take a break after the class. And for recreational purposes, they need to reduce the amount of usage, meaning that they can do other things. For example, paint, play games, do certain exercises, or engage in other activities. So even for technological use, we need to structure and use routine wisely for children not to get overstimulated with these technological devices. I don't know if Mohammed or Dr. Rao or Amir, you have a different approach regarding this, but parents are a little bit worried and they don't know what to do, because before it was easier to control it, just take the cell phone away or ask them to turn off the iPad or the TV, but now they need to be connected for class. So this is very difficult, and they are having a difficult time controlling what their children are doing.
Can I make a comment on what you said? I think when you take away something, you need to put something there. You cannot just say, don't use it. I mean, you need to have a plan. The example that I gave you, if you're asking them not to spend time on their mobile, you need to put a physical activity with them that you are willing to be involved. That's the issue of parenting. The devices and the money that you throw at your kid will not replace your attention. So if the parents are there to attend to the kid and spend time with them, then they can replace it, because always kids love to spend time with parents. Unfortunately, we are replacing money, our resources, and the new devices, and we all ourselves become completely absorbed into our social media, and we forget, so the issue, I think, is how much me as a parent am willing to spend time with my kids and not ask them to be on their devices, because then I shouldn't be on my devices too. The issue is not just the kids, everybody's on their devices. Who doesn't have Instagram? Who doesn't have Facebook? Who doesn't have TikTok? All of them, okay? So the adults are worse than kids. So if I want my kids to grow healthy and have healthy behavior and develop socially in a right way, I need to be right myself. I need to spend time with them. So I think that's the point. It doesn't need interventions coming from heavens. It just comes the way that the old families spend time together.
Yeah,
We
that's
would
all
spend
about
time together.
interaction, Amir. Yeah, you're absolutely
Yes.
right. That's all about interaction. That's a question that we're getting a lot from the people who are consulting with us. They're saying, but we want how we can make our children get smarter, how we can make them stay healthier, having a better. I would like them, my children, to be on top of the game that he or she has been doing, performing well at school. Our first advice to them is that talk to them, spend time with them, interact with them. So if we're leaving our children in front of the TV for a couple of hours or more, and they are just, using this one-way street, and the brain is going to be frozen by time, so they wouldn't have the chance and capacity of forming new connections. The synapses wouldn't get a chance to go for long-term potentiation. So all the different cognitive constructs that we expect that to build up in a specific milestone of neurodevelopment would not necessarily be there. So I totally echo what you highlighted, and by that we would all pass to Professor Rao to make the final comment, and maybe we need the final quote, and then perhaps if you see appropriate, we're going to close it off with the conclusive remarks.
Thank you very much, Dr. Mohammad, Dr. Amir, and Dr. Diana, for your wonderful interactions and giving new directions on especially mental health issues under the current situation. And we all know that it's not just support from the healthcare workers, or psychiatrists or psychologists or neurologists, but also, as last day all of you pointed out, you have to have a family networking, to support each other, to make the complex issue into a solution. That's very important. That Amir rightly said, that how you need to be a best example for your children, so that, because this is a stress people undergoing in education model, so many things, as Diana explained, but it is a big challenge now, because we know that in next coming 2 years, this is going to be a big issue. It's not going to end in next 1 month, 2 months. So we need to cope up with that kind of condition, and then we need to plan what are our opportunities, what are our excitements, and how we need to have a healthy life system, and how to maintain good mental health issues. These are the major challenges everybody has to, think, plan, and adapt to the system. That's very, very important. on this process. And I think this opened up a new dimension, for me to understand, and for many of us to understand. So I think if Mohammed and Diana and Amir agrees, I also have Dr. Britton from our institute. I think we should able to have one full seminar, only COVID and brain, how it's going to affect cognition, how it's going to affect mental, issues, and, clinical complexes, what we have, because we know that COVID is not a simple respiratory failure now. It affects all the parts of the body. And the second important aspect in clinical parameters, I think Amir is an expert on that. So each person, the response to COVID infection is completely different. There is no uniform direction to say, oh, this is going to happen if we have a COVID infection. We have asymptomatic, we have symptomatic. In those conditions, for example, if someone becomes COVID positive, there are many predictions coming out. Okay, what will happen to the people's brain activity after that, post-COVID infection? So I think we should plan a full seminar on that to highlight the information already available in the literature. The reason why I'm proposing this is, as Mohammed rightly pointed out, and Diana and also Amir, the people need to get a correct information. That's very important, evidence-based information to the people, because I know many people call me, oh, there's a vaccine, when we are going to get vaccine? Oh, there's a drug, can I get this drug to use? Like, people are kind of rushing to the, to the kind of solutions. I know, because there's a kind of emergency situation, but I think we need to provide correct evidence-based information to the people. Because as a neuroscientist, I believe that we should be able to do that. I think we will have a next seminar on only COVID and brain. So what is known so far?
Fantastic.
What is known so far? So how it is going to be regarded, no? So we'll plan.
Yeah, I agree. I agree.
Sure.
Yeah,
I mean,
excellent.
Yeah. And no one actually introduced. No one introduced you, Rao, sir, because you moderated the session, but no one has heard about you. No one needs to introduce you, because you've been doing a great contribution. You've devoted your career to understanding the brain and also neuroscience, and you've been doing a lot. And I was privileged to get to know Professor Rao during our visit to China in Beijing some months back. Uh, he is my mentor.
In October.
Yeah, in October. He's my mentor, and he's been a very, very thoughtful advisor for the common shared projects that we've been doing for the past 6 months. It's been really a flourishing collaboration, and I'm very optimistic that with the leadership of Professor Amir and Professor Rao, and the help that we're expecting to receive from Dr. Diana, certainly we're going to make the building blocks of our collaborations there, and then by that we'll just pave the path for the future endeavors to add value to the body of knowledge and attitude level of practice in terms of brain, and also all the different cognitive behavioral dimensions. And I couldn't be prouder for being among this great, thoughtful panel of experts. And I'd like to appreciate Indicasset for organizing this. I'm a part of Indicasset already, and Dr. Rao has been very gracious and open to, open up new windows for shared initiatives and shared collaborative quests and also researches. And I'm also very thankful to Professor Amir. He's also one of my other great mentors. And I'm always thankful to Amir. And he's been like a crony to me, and has been teaching me a lot over the past 10, 15 years. And I'm very happy that he's here with us, because we're using and listening to him, using his wisdom and his knowledge for years that he has been spending on studying the sleep, brain with connection to breathing, heart, and all different internal medicine dynamics. And Diana, She's my new colleague, but it looks like that we've been working long together. Yeah, because we just had one chance of discussing together, but it turns out that we have so many things in common, and we're going to put that into synergy. So by time, definitely many good things will happen. And please, parents, scientists, scholars, and physicians, colleagues, if you see children that they are having predicaments with neurodevelopmental processes, they have Down syndrome, they have Rett syndrome, they have Asperger's, ASD, they have problems with their attention, hyperactivity, they have issues with their movement, they have problem with their speech, they are verbally developmental, they're facing with verbal developmental delay, and so on and so forth. And we're spending time, energy, and resources to help them with occupational therapy. They do not gain. We spend time, energy, resources to speech language therapy. They do not gain. So let's take a moment to think about their sleep parameters and to make sure if they're sleeping in a proper way, if they had good bioparameters, acceptable bioparameters for sleep structure as for their age or their gender. And if there's a problem, let's get them tested. And by that, let's go for precision medicine. If there's a need for medication, we'll do medication therapy. If there's a need for a behavioral cognitive therapy, we'll use it. And technology is also there, provided it's going to add a value, we're going to use it. I'm just going to close my notes here. And I, again, want to thank you and all the audience for being here. For me, that was nothing less than outstanding experience to be with you guys, the respective panel, and the people who have been already joining us in this function. As Dr. Rao pointed out, we're going to have this continued in the future activities. Fingers crossed for all the success. We're going to celebrate the success together. Sure.
Thank you, Mohammed. I'm honored to have been here with you today, and I would really love to work in a neuro COVID project. We are actually starting one in Indicasat with my mentor and my boss and the head of the neuroscience department, Dr. Britton, and we would very much appreciate if you would include us in this neuro COVID project, because it is necessary. And like Dr. Rao said, it's fundamental to give reliable information to people. This is a big problem in Latin America, and we wanna we wanna acknowledge that, and we want to contribute to people receiving good, reliable sources and information.
Before I close, we would like to highlight, with the younger minds like Diana, and we have a senior person, Dr. Britton, who is heading the neuroscience, doing a very commendable contributions in Panama. That's the first center actually built. So with Amir and with Mohammad and Dr. George Perry, with Dr. Murali, all team together, it's our dream that in next 5 years we should have a neuroscience institute actually, under the leadership of Dr. Britton, with the main younger people joining together, and with an evidence-based understanding of many new contributions coming from Latin America. And then we are very positive on that, and also we are releasing a special issue on neuroscience developments in Latin America, from basic to translation in the specialist of Journal of Alzheimer's Disease, to highlight how much has been contributed by Latin America to the field of neuroscience in the world. So we see you in next meeting on COVID and brain. So we will go with the more details and announcements soon. Thank you very much to all of you, Dr. Mohammad, Dr. Diana, and Dr. Amir.
Thank you, Dr. Rao.
Thank you so much.
Have a nice day. Take care.
Thank you.
Have a nice day.
Enjoy the rest of the day.
Bye, doctors.
Bye-bye. Thank you so much. Thanks. Thank you, everyone. Bye-bye.
Gracias a todas las personas que se conectaron, y cualquier duda nos pueden escribir al correo. Hasta luego. Muchas gracias.